Thank you for joining us again for another educational video. Tonight I'm going to be talking to you about frozen embryo transfer cycles, something that we're commonly using in the infertility world for treatment. Frozen embryo transfer cycles are a result of embryos having already been frozen from some other source, some other reason in your treatment plan, and now it's time to put these embryos back into the uterus to achieve pregnancy. Finally, the fun part of our treatment. The majority of patients are having embryos frozen these days for different reasons. They might be having genetic testing done on their embryos, or maybe they're just freezing them to preserve their fertility. But when it comes time to use them, we have to undergo a frozen embryo transfer, and that really involves preparation of the uterus to receive the embryo. So when we do a frozen embryo transfer in simplistic form, what we're doing is we're giving estrogen. Estrogen is a hormone that causes the lining of the uterus to become thickened. It grows and thickens up. And then the second part of the treatment is a hormone called progesterone. And progesterone is added to the estrogen, and progesterone is what causes the endometrium to age, so that the age of the endometrium is the same age as the embryo that's going to be placed in there. Most embryos these days are 5 or 6 day old embryos, so that means the uterus has to be prepared appropriately. Now, once the uterus has been prepared, then what we do is we have you come in for an embryo transfer. So the embryo transfer, what you would expect on that day is after you've had your hormones, we've made sure your lining thickness is good, timing is just right, then you come into the office with a full bladder. And the reason for the full bladder is we want to be able to utilize an ultrasound on top of your tummy that looks through your bladder at your uterus so we can see where the embryo is being transferred into. And then what we do is we place a speculum, just like a pap smear, visualize the cervix, and then we have the embryo loaded by our embryology staff into a very soft catheter. That's this one right here. You can see it moves. It's very soft and pliable. That is the part where the embryo is put into that goes into the uterus. So this white part goes into the cervix, this part goes into the uterus, and then the embryo is very gently let go right into the center of the uterus where it's supposed to stay, and hopefully will implant and grow and turn into our baby. Once we're done with that, the embryo transfer is complete, and then we're waiting 10 days for pregnancy test results. There's a recent improvement in our technology that we've been using for a lot of patients, which is helping us to identify whether the preparation of the uterus is appropriate for a particular patient or not. That's called Endometrial Receptivity Assay, or ERA. And it's kind of a trial run of a frozen embryo transfer preparation, but then we actually test the uterus with biopsies to make sure that it's prepared appropriately for your embryo. And then once we have that information, we can fine-tune your cycle even further as to when is the most appropriate time to put that embryo in there. And we do that usually the next month with your transfer cycle. So I hope you learned a little bit about frozen embryo transfers today. If you would like any more information about it, please see us at NCRM, Nevada Center for Reproductive Medicine. I'm Dr. Scott Whitten. Thanks for listening.